our faculty and staff, as well as some upcoming events that you should be aware of. So we will go ahead and get started. I'm going to share my screen. Okay. So like I said, this is Gamecocks Live Well, which is our faculty staff wellness services and benefits program here at University Health Services. So we're going to go through a couple of these pieces that you will see coming your way, as well as some things hopefully you know about, but we want to highlight and make sure that everybody's on the same page. So coming to a mailbox near you, we have our Gamecocks Live Well postcard that will be put into every faculty and staff member's box in the next week or so. So what this is going to do is going to drive you to our new website. The website is new and improved for faculty staff wellness. We have split kind of our offerings into 3 different categories to kind of help our faculty and staff determine what is right for them at the right time. So this QR code will take you directly to that website. And basically our 3 philosophies that we're going to break it down for is what can we do for you? What can we do for your department? And then how can we help you to provide that student support if you do have that direct interaction with our students. So for you, those are going to be things that are going to be challenges, classes, presentations that you yourself can participate in. You don't have to have a team. You don't have to have kind of a department involvement in it, in any of these actions. Each of these 3 sections, we do break down the website into categories. So you'll see general wellness, you'll see physical activity, you'll see nutrition, you'll still see kind of our interpersonal violence and mental health offerings, so that hopefully we have categorized things and cataloged things that are going to be easier to find for folks. For your department, these are going to be things that you'll see some cross collaboration on for you and for your department. And these are going to be things that you can do as a department. If you find something that you like in for your department and you don't necessarily want to do that with your department, you're more than welcome to do that on your own. It is just geared towards kind of that broader and bigger audience rather than those individualized services. So these are going to be things like classes, presentations that we can bring directly to your department, whether that be in a virtual setting like this, or we can come out in person. So we're going to really help folks to reach those wellness goals as a team rather than that individualized services. And then support for your students. So folks who do have that direct contact and direct interaction with students, you may get questions, you may see certain red flags that you may want to just have a resource available to you. And again, this section is also kind of built out from nutrition to interpersonal violence, mental health, etc. So you can really interact on a case-by-case basis, as well as you can always reach out to us here at Live Well for Gamecocks Live Well at the University Health Services. If you don't see something or need some just guidance on where to go to find whatever it is you're looking for, and we can definitely help and get that out to you. Again, these postcards are going to be coming out to your mailboxes within the next week or so, so please feel free to kind of use these cards, reference them. If you have any questions, reach out to us. We're happy to walk folks through those. So flu shots are coming in. We will have a kickoff event today on Green Street. If you see what we have called the big blue tent, that will be out on Green Street today until about 4 o'clock, I believe, where they will be giving flu shots out starting today in their kickoff event. We will also be holding kind of walk-in flu shot clinics here at the Center for Health and Wellbeing, located at 1409 Divine Street, throughout the month of October. So you'll be able to just kind of walk in for that. They do ask that if you would like to schedule an appointment, that you can do that on My Health Space. At this point, it's still September, so you won't see that option available. So you should see that starting, I would say Monday. I would say October, but that's going to be on Friday. So I would give us till Monday to make sure that we have all of those appointments up and ready on My Health Space. You will need to complete your influenza vaccine consent form, as well as ensure that your health insurance card is uploaded to your My Health Space account. We do file the flu shot on your insurance, but there's not going to be any out-of-pocket costs for you for receiving your flu vaccine on campus. So you may see this graphic coming out. We will have some mobile clinic dates and locations. So I encourage folks to just kind of take a look if there's any locations that may be a little closer, more convenient to you, rather than the Center for Health and Wellbeing. Again, we're located kind of right smack between Thomas Cooper Library and Russell House. So if you're on Russell House patio, you will enter our building through the second floor, and that is where we will be holding those flu shots. And then again, if you are closer or one of these locations is a little more convenient for you, then please remember you can always visit these locations as well. We are deep into the throes of COVID testing and kind of the monthly testing. I believe this is the first week for round 2. So if you are in group 1, this is your week to test. We do offer on-campus testing for faculty and staff. There is no charge for it, and there's no appointment needed. It is our saliva testing that is brought to us by our partners here at the College of Pharmacy. The location is 1311 Pendleton Street, which is directly off of the Horseshoe in the old Synovus Bank building. There is parking available, so this is going to be those spaces 1 through 20 that you'll see marked clearly when you're over there. The times for that is 7:30 to 4 p.m. They do close it up pretty quickly at 4 p.m., so just know that as well. And then those results will come directly to your My Health Space account. There's nothing else that you would need to do. So once we get the test here at University Health Services from College of Pharmacy, we will automatically make that compliance piece for you compliant in your My Health Space account. So you don't have to upload a test or anything like that. If you do go off campus for testing, reporting your COVID-19 test is fairly simple. So all you would need to do is to upload a copy of that test to your My Health Space account. You would simply log into your My Health Space. On the left-hand side, you'll see medical clearances. And then once you click in there, you will see your COVID-19 test for group, insert your group number, 1, 2, 3, or 4. You would click on update, upload a copy of that file, whether that's a picture, whether that's a PDF, a scanned document, anything like that. You can upload that directly to My Health Space, and then we can go ahead and get you cleared from that point. If you have questions about your group number or the accepted test, that can be found on our COVID landing page, which we've provided the tiny URL here. And then current DHEC guidance recommends that community members test for screening purposes on a monthly basis. So if that gives you a little bit of the why of the monthly testing piece, we do recognize that there was a little bit of confusion in the beginning because folks were uploading their immunization, their COVID vaccine twice, thinking that we were good to go. Even folks who are fully vaccinated are required to do the monthly testing, and that's just based on kind of the guidance that we have from CDC as well as South Carolina DHEC. If you have a positive test, you would not need to test for the next 90 days, and our system will automatically clear that. So if you test positive in, let's say, September, you wouldn't need to test again until 90 days after that. So we would mark that compliant on our side automatically, so you would not need to do any additional steps there. So the other side of this is our COVID-19 vaccine clinic. Students, faculty, and staff, as well as community members, can visit us here at University Health in the Center for Health and Wellbeing anytime between 9 and 3, Monday through Friday, for a COVID vaccine. You don't have to have an appointment. You can walk in. Again, if you would prefer to have an appointment, those are available on My Health Space. The two options that we currently have are Moderna and Johnson & Johnson. So we do not carry the Pfizer vaccine, which means we do not carry the Pfizer booster. So just keep that in mind as you move forward in thinking about how to kind of make your vaccine choices and decisions with us here at UHS. If you are vaccinated at a non-university location, we do ask that you go ahead and upload that card. Many of our faculty and staff have already done that. You can see those percentages weekly in our dashboard that goes out on Tuesday afternoon. So you can see specifically faculty, student, and staff, and the percentages of vaccination rates with those individual groups. To find directions on how to upload your vaccine card, as well as just more vaccine information, we've included a tiny URL here for our vaccine landing page for you all as well. Okay, so back into the wellness piece for what we do here. So we do offer worksite screenings, and those are a no-cost preventative screening to faculty, staff, and retirees, as well as their covered spouse or partner who use the primary insurance coverage as the state health plan, whether that be standard or savings. So it doesn't matter which option you choose, as long as you're in that state health plan, then you are eligible for these worksite screenings. So what's included would be kind of the basic panel that you see here. So lipid, metabolic, complete blood count, as well as a blood pressure check and height and weight. You can schedule an appointment by calling our phone number here listed, 777-6518, and we will go ahead and get you into the rotation for one of those state health plan worksite screenings. Again, these are offered at no cost, as long as no additional panels, whether that be lab or any other panels, are added. If those are added, then those would be filed to the insurance for charge. Wellness coaching is also something that we are really excited to kind of bring back in full force this semester, after kind of having a hybrid year and kind of an off year in 2020, and we're really excited to kind of bring this offering back. In a wellness coaching session, you'll meet with a trained wellness coach for a one-on-one assessment. You really get to guide how the sessions go. So we base our sessions based off of your wellness goals, and really kind of create the plan based on whatever your end goal is and kind of how you want to get there. Our job is to provide that support, guidance, and encouragement in a judgment-free zone. So that's really what we strive for in these wellness coaching sessions. The focus of most of our sessions is going to be balanced eating, physical activity, stress management, as well as tobacco cessation. We are offering these through the Microsoft Teams platform in a virtual setting, as well as in person in the Thompson building. So Thompson is the building that is connected to the Center for Health and Wellbeing. And to schedule those appointments, we've put that phone number on there for you as well. And you can book coaching appointments through the My Health Space portal. So the worksite screenings you would need to call in order to have your appointment scheduled. But for the wellness coaching visit, you're able to do that one of two ways, either to call the phone number or to schedule that through your My Health Space account. Some mindfulness services are the next piece that I want to review and go over for you all. So first and foremost is our yoga. We have Claire, who has done a great job over the past several years in our Calm Oasis as our yoga instructor. And so you can join a couple of different ways. One is in person. So she is back in the Calm Oasis here at the Center for Health and Wellbeing, and you're welcome to join her. We do limit the number of folks who can join live and in person. That number is 6. So if you are interested in that, please visit our faculty staff wellness page on University Health Services to register to be an in-person participant in our yoga classes. If you are not going to come over to the Center for Health and Wellbeing, but you still want to participate in these yoga sessions, we do go live on Facebook. So if you haven't already, I encourage you to join our Facebook group, Gamecocks Live Well. And we promote that, of course, on our Healthy Carolina page as well. The time for those yoga sessions is listed, but most of them are in the afternoon, as well as we have one evening class on Monday. Some additional mindfulness services. So our fall mindfulness series is live streamed on Microsoft Teams. You can register for that series that starts next week. Right here on this page, we'll go ahead and make sure you have the link for that. Basically, in this mindfulness series, you will go through these various topics and really kind of be able to create some coping strategies and some mindfulness strategies to be able to get you through each of these different stressors or just topics. I love the holiday stress one, so I'm really glad that that one's going to be included this year. And it looks like it's right before kind of the holiday season of Thanksgiving, and then our mini holidays in December kicks off, so that's great. Our meditation sessions are also live streamed, but these are on the Gamecocks Live Well Facebook page. We've altered these a little bit. They used to be called our midday meditation. As you can see, we've started offering 2 of those in the earlier morning hours. These are fairly quick, so you can join at 7:45 or noon and be kind of on and about your way in about 15 minutes or so. They are also they're live stream, but you can watch them at any time. So if 7:45 or noon is not an ideal time for you, then you would be able to kind of go back into our archive of guided meditations and desk stretching exercises, which are also available on that Gamecocks Live Well page, to be able to tune into those. We have a lot of different instructors, so it's not just one. So please feel free to kind of search through those and figure out which instructor is going to be the best suited for you. And then our final kind of, it's a little bit different than a mindfulness segment. It's our Inner Path to Peace. It's a 3-part series that really kind of go into mindfulness and meditation and the science and benefits behind both of those techniques. So you're going to learn to create your own, which I think is a really powerful and exciting experience for folks. Meditation is not required or necessary. So we hear a lot of folks that say, you know, I can't clear my mind, or meditation is just not for me. And so this program really helps you to tailor what is for you when it comes to mindfulness and those meditation practices. Attendance is encouraged strongly for all 3 of those sessions. In about 2 weeks, we will start another series. So the series will begin on October the 11th. It will be those subsequent 2 Mondays as well. There's an interest form that you can fill out if you're interested in kind of getting some more information, as well as getting yourself registered. Something I'm really excited about is our Fall into Wellness Challenge. So this begins on Monday, so please sign up if you haven't already. It's a 4-week step challenge. We're going to set goals for yourself each week so that you can track your steps and submit those. You'll receive an email each week that's going to give you some tips and encouragement. It's also going to be able to show the leaderboard. So we'll be able to see kind of who's in the lead and who's making those big jumps, whether that be as a department or as an individual. So if you have a group of colleagues a department you yourself want to join kind of by yourself, this is a great opportunity as we hopefully start to feel some of these cooler temperatures here in Columbia, that we can get outside and get some extra steps in throughout the month of October. Again, it starts on Monday, so you can register now through, I believe, the first part of next week, and then that will go through Halloween, so it'll go through October the 31st to get us through that month of October. Wellness ambassadors is something that we are resurrecting. We are really trying to focus in on this great group of dedicated employees who are really champions and committed to helping to increase the health and wellness of their fellow colleagues. So if you're interested in becoming a wellness ambassador, I encourage you to visit this link. It's a pretty low maintenance type designation. Basically, we would send you kind of all of our information as we're doing these programs. You can send those out to your colleagues. You can also kind of make it even more. So you really get to decide kind of where you are building your wellness initiatives in your area. And we are here to support you and provide information. So if you wanted to have, a wellness board or a wellness Wednesday or something like that, we can help and really kind of spark those creative ideas. But we really want that information to come directly from our departments so that they're really bought in, and it really comes from kind of the grassroots type scenario. Another option that we are really excited about resurrecting this year is our Certified Healthy Workplace designation. So what we do say is that if you are going to be a CHW, so a Certified Healthy Workplace, then you do have to have a designated wellness ambassador. So it's kind of a two birds, one stone type situation. And it recognizes departments on campus that really support the wellness culture, whether that be through leadership support and departmental participation. So you would just fill out kind of an application for that designation, and then our Working Well group of folks would review that, and then there's a tiered effect of awards there. So bronze, silver, and gold, which we're pretty familiar with the Olympics just finishing and looking forward to January's Winter Olympics. So those designations, what we will do is if you are a silver, we will congratulate you and point out kind of the great things that you're doing. And then we'll also offer some recommendations of how in the next 12 months you could achieve that gold standard and gold award designation. So again, please check out our Certified Healthy Workplace for your department so that we can make sure that we are spreading the good news of again, positive wellness culture through that leadership support and departmental participation across campus. Some other pieces outside of the wellness world that we offer here at the Center for Health and Wellbeing through University Health Services is our pharmacy. One of those is our pharmacy. So you can get your prescriptions filled with convenience of not having to leave campus. It's really very simple to kind of visit the pharmacy website and kind of immediately switch over your prescription so that they're housed here. And that way you can pick those up kind of at your leisure. Again, we are an in-network pharmacy with the state health plan. So if you do carry that state health plan, it's going to be those in-network prices that you can view in your benefit summary. If you have questions or want to know more information, our pharmacy phone number is listed, and as well as the website's not listed, but it's UofSC.com. So that's a great resource for you as well. Our SAVIP services, so SAVIP stands for Sexual Assault, Violence, and Intervention Prevention. Services. So SAVIP is our on-campus interpersonal violence advocacy and prevention center. for our UofSC Columbia faculty, staff, and students. They are located in the Thompson building of University Health Services, and they're able to offer 24-hour services to our faculty, staff, and students, whether you're a primary or secondary survivor of sexual assault and harassment, relationship violence, and assault. So they provide kind of that primary prevention programming, such as bystander intervention. That program is called Gamecock Stand Up. So you may have heard of that. I encourage you, if you are a faculty member, or even if you're a staff member and have a staff department meeting, get the bystander intervention Gamecock Stand Up is a great way to kind of bring in content to your classes or your department meetings, so that your faculty and staff colleagues kind of have a greater understanding and hopefully confidence to be able to implement those bystander interventions. As well as we offer trainings and classes on healthy relationships, interpersonal violence, and trauma. So we have a Trauma 101 class that's coming up. If you visit our faculty and staff website on the University Health Services page, in the For You tab, you will see information about that Trauma 101 class that is upcoming. To access any services from SAVIP, whether that's programming, training, or advocacy information, this is the phone number to call, and that is a 24/7 phone number. So you can reach any of our staff at any point in the time during day or night with that phone number, or you can visit our Stop Interpersonal Violence website, which is located right there. That website was previously called Stop Sexual Assault. Again, we're kind of rebranding that information as Stop Interpersonal Violence. So if we have not covered something that you still have a question about, this is our phone number, this is our email address, and this is our direct link to our Facebook page. Any of these three ways will get you in touch with our team, and we can assist in getting you that information or clarifying anything that might have been confusing, as well as being able to take in some requests regarding us coming out to your faculty or staff department meeting or anything else like that. All right, so I'm going to leave a little bit of time here for some questions, if anybody has any that I might be able to answer. And I will monitor the chat, but feel free to unmute and ask those questions if necessary.